The Plastic Surgery Channel News, brought to you by Mentor, maker of memory gel breast implants.
Welcome to Plastic Surgery News. I'm your host, Deanne Moore. Thank you so much for joining us today. In this week's report, we'll show you a new innovation designed to make breast augmentation surgery easier. We'll also fill you in on a study of the safest fat grafting procedures and tell you about a man who is going to court after being turned down for breast augmentation. All of that coming up, but first, Americans who want plastic surgery may be focused on the future of healthcare in this country, but Canada seems to have similar issues. Canada's nationalized healthcare system often means long waiting times for some patients, but a network of private clinics and surgical centers in the British Columbia are now offering much faster service. This has cut down on the number of Canadians who come to the United States for certain operations, including cosmetic surgery. Right now, these private clinics are technically illegal, and the British Columbian government is deciding whether or not to sanction them. Some say Canadian citizens should be able to choose what kind of health care they get, private or public. Others say that offering more private clinics in Canada will rob the public hospitals of skilled employees. Courts there are deciding more about the sanctions this month. Next in the news, a new device designed to help doctors insert breast implants during surgery is being unveiled at the annual meeting of the American Society of Plastic Surgeons this weekend, and it may offer several advantages. The Keller funnel delivers a breast implant directly into the patient's body without the doctor having to touch the implant, which may possibly cut down on trauma to the implant and decrease the risk of infection. The surgeon places the implant inside this device, which is a cone-shaped funnel. Then, after inserting a small end of the funnel into the breast pocket, the surgeon can squeeze the device and push the implant into place. The Keller funnel may offer several advantages, including decreasing implant trauma and reducing the chances of contamination because of its no-touch system.
You can actually load an implant into this funnel and never touch it. And there's a lot of reasons not to touch it. Anytime, although we're in a sterile environment, we're using sterile gloves, we're using antibiotic solution to bathe the device and the implant. Anytime there's contact with skin or any kind of materials, there's some risk, be it minimal, some risk of some contamination with bacteria. And it's been shown that those increase rates of capsular contracture and infection. So if you can get by with that implant never touching anything except its new home, then you've accomplished something there. So we can actually pour the implant into the funnel, never touch it, orient it, put it into the pocket, and we've never even handled the implant.
Doctors say that over the next year or two, as surgeons gain more experience with the product, its application for breast implant procedures will better be defined. Coming up next, find out what some doctors say about the safest way to perform fat grafting. But first, a quick break. We'll be right back.
Hi, I'm Dr. Bill Adams, and you're watching the Plastic Surgery Channel. Last year, more than 350,000 women decided to get breast augmentation.
It helped me understand what my body would be like after the surgery.
Speaking of hard fats, let's talk about your olfactory organ.
So a prospective patient, when they're looking to have surgery, must always understand that every single surgical procedure has its import, and they must be concerned with the quality that's being delivered to them.